Right, welcome everyone to our latest Data for Nutrition webinar, where we're going to talk about how can we measure nutrition-sensitive social protection, unpacking data, challenges, and opportunities to improve nutrition through school feeding programs. We welcome those who are participating live, but also those who are watching in follow-up on YouTube. Next slide. So just before we start, those of you who've been on our webinars know that this is our standard housekeeping. We do mute all participant video and microphones during presentations. And we ask that you use the Q&A button to submit your questions that you have for the panel. And please feel free to submit those while they're speaking. And then when we come to the Q&A time, we'll get to as many questions as we can. And a recording of this webinar will be available on the Data for Nutrition YouTube channel immediately. And then presentation slides and a question and answer summary will be posted in the community in the coming week. Next slide. If you're having any trouble at any point, please use the chat window, not the Q&A window, to reach Riley Hour. And we'll do our best to respond to any tech issues you're having during the webinar. So a reminder about Data for Nutrition. So the Data for Nutrition community of practice provides members with opportunities to share knowledge, experience, and questions relevant to strengthening the nutrition data value chain at all levels for the purpose of achieving better nutrition outcomes in low and middle income countries. Since we launched in early 2020, we've grown to more than 875 members. I'm your moderator today. My name is Rebecca Heidkamp, and I'm an associate scientist at the Johns Hopkins Bloomberg School of Public Health, and I lead the DataDent initiative. Next slide. So just to say, why is it that we are trying to pull together a series of webinars that are focused on measurement of nutrition-sensitive social protection? Well, we've been hearing for years that nutrition is a multi-sectoral discipline. Or that nutrition problems require multi-sector efforts to solve. And we do have this growing evidence base for nutrition impacts of actions beyond the health sector. However, we actually often struggle to say who is actually being reached with these multi-sector interventions. And the short answer is we really don't know. Many countries have social protection schemes that reach some of the populations we prioritize in nutrition, especially women of reproductive age and young children. However, most surveys and administrative data systems that are used by the nutrition community, like the DHS surveys or the DHIS2, are not capturing coverage of these platforms that might be through schools, through other schemes among the target groups. So school feeding is a great example of one of the major types of social protection schemes that have potential nutrition impacts. And so DataDent has partnered with the Global Children's Nutrition Foundation to advance a joint measurement agenda. And we're also thinking a bit about cash and food transfer programs. And so that's the work you're going to hear about today. But I do want to remind folks that Data for Nutrition is an open platform. And if anyone has any of their own examples of work you're doing around measuring nutrition-sensitive social protection and who's being reached, we welcome you to reach out because we would love to feature your work in a webinar or in another format. Next slide. So I want to introduce you to today's speakers. Ayala Wineman is the research coordinator at the Global Children's Nutrition Foundation, and she'll be our first speaker, followed by Nadia Akseer, who is an assistant scientist at the Johns Hopkins Bloomberg School of Public Health, and also has a few other affiliations. So without further ado, I'm going to hand over to Ayala.
Thanks very much. Are you able to hear me?
Yes, we hear you and just need you to put your slides into presentation mode.
All right. Thank you very much for that introduction. And I also want to note that Arlene Mitchell, the executive director of the Global Child Nutrition Foundation, is also with us today and will be able to engage during the Q&A time. Okay, and so to set the stage, let us first establish why school feeding programs are important. As Heidi noted, school feeding programs are among the world's largest social safety net programs, I think that school fee waivers might be the only social safety net program that might be larger. School feeding programs are found in at least 161 countries in the world. They're found in some form, and they reach over 380 million school children. Now, school feeding programs are important precisely because they support children beyond the first 1,000 days. They reach children and adolescents through the first 8,000 days of life. Now, there are a number of ways in which school feeding programs are related to nutrition. So the most direct link, the most obvious link, is that school feeding increases the amount of food consumed by beneficiary children. So there's a decrease in hunger. School feeding programs can also improve children's micronutrient status, especially if the menu is diverse, and it includes fortified food items. School feeding programs can also influence obesity, although this link could go in either direction, positive or negative, plausibly. There are also some links between school feeding and children's nutrition that are somewhat less direct. For example, school feeding programs are very commonly packaged with complementary health programs, such as deworming treatment or the provision of clean water in schools. Healthy school meals might establish a habit of healthy eating that stays with children throughout their life. So there's a long-term potential impact. And there's even a potential intergenerational impact in that school feeding can be used to incentivize girls to stay in school longer, and better educated mothers can make healthier choices for their children. Just recently, there was a lovely paper published by Chakrabarti et al. Looking at the midday meal scheme in India and finding that girls who benefited from the midday meal scheme, when they grew up, they had children who were healthier than others. There are additional links that are even less direct between school feeding and nutrition, but these links are still important. For example, it's been documented that in some cases, school feeding benefits the younger siblings of school children. School feeding programs also create jobs and generate income for farmers, cooks, and caterers. And so that improved income status can translate into improved nutrition for their families. And finally, homegrown school feeding, which is a type of school feeding in which the food is sourced locally from small-scale farmers. This has potential to support more diverse food systems, which could have a community-level nutrition benefit. So there are a lot of potential links between school feeding programs and nutrition. What about the data that underlies what we know about this link? In 2018, the Global Child Nutrition Foundation conducted an exercise where we surveyed the available information on school feeding programs in almost every country in the world. And we did this in coordination with a group of master's students at the University of Washington. What did we find? We found that the quantity and quality of information available on school feeding was extremely inconsistent across countries, and sometimes even across different programs that were operating within the same country. We were more likely to find detailed data for programs that are implemented by the World Food Programs, and less likely to find good data about programs implemented entirely by national governments. Although the latter set of programs, they are large and they are important. We found that information was not collected and published regularly over the years. And so pulling together a picture of what was happening in school feeding in a given country involved pulling information from a whole, all these different years together. And finally, across almost all countries, there were some pieces of information that were difficult to find. So this pre-existing data landscape is what inspired Donald Bundy and co-authors in 2009 to note that what was missing in the world and what was urgently needed is a database on school feeding programs that describes the coverage and functioning of programs globally, so that we can look across the globe and know who is reached by school feeding programs, where are the gaps in coverage, what are the different modalities through which populations are reached. So this quote came from 2009, fast forward 10 years to 2019, and not much had changed in this space. That's why in 2019, the Global Child Nutrition Foundation stepped forward with the Global Survey of School Meal Programs. This survey, which is conducted at the country level, it gathers information on the scope of school feeding in every country, government involvement in school feeding, topics related to nutrition, education, and gender, as well as agriculture and private sector engagement in school feeding programs. The survey covers topics around health and sanitation. It captures the number of jobs that are created through school feeding programs, and it also covers the impact of emergencies such as the COVID-19 pandemic. So the inaugural year of the survey was 2019, and the second survey wave is 2021. The global survey gathers information at the country level and also at the level of each large-scale school feeding program operating in the country. And the survey is designed to be answered by a government representative, what we call a survey focal point. And it's very important to GCNF that the individual who is responsible for answering the survey for the country be a government representative. Partly because we think that participating in this exercise will lead to an improvement in what the government knows about school feeding in their country, and also an improvement in future data and reporting. Around the topic of school feeding, it's critical that we have a standard set of definitions. And this is why the survey comes with a glossary with terminology and clear definitions. And finally, from the 2019 survey, we established a unique global database of standardized information on school feeding programs covering all related sectors and activities. Okay, so we launched this survey in 2019. How did we do? In 2019, the global survey drew responses from 103 countries, representing 78% of the world's population. Of these, 85 countries responded by saying, yes, we have some large-scale school feeding going on in the country, and they reported on 160 individual programs. And the 2021 global survey data collection has just started and will continue over the next few months. And a quick overview of what is available from the global survey on the GCNF website. The GCNF website includes country reports, which are very succinct summaries of what's going on with school feeding in each country that responded to the survey. We have a large report summarizing the survey results called School Meal Programs Around the World. There are also shorter resources on specific subtopics related to school feeding. The data set that derives from this survey is available to the public. So other analysts and practitioners are able to access the data and use it as they wish. And finally, the 2021 survey questionnaire and glossary are also available on the GCNF website. So if you're interested, I encourage you to go take a look. I think it's very interesting. Now, from the 2019 Global Survey of School Meal Programs, what were we ultimately able to learn about school feeding and nutrition? First of all, we were able to document the manner in which program coverage tends to be lowest where needs are greatest. So if you look at this figure in the bottom panel with the blue bars, this shows that lower income countries tend to have lower average school feeding coverage rates relative to higher income countries. And this correlation is even stronger among the children of secondary school age. We also noted a correlation between coverage rates and having school feeding as a national budget line item. So countries that have school feeding as a line item in their national budget are likely to have a higher school feeding coverage rates among their children. We noted from the survey data that food basket diversity tends to increase with rising wealth. Food basket means the food items that are served to children or provided to children through school feeding programs. This could be in the form of meals or also take-home rations. Across different regions of the world, school feeding programs in Latin America and the Caribbean, on average, they have the most diverse food baskets. And school feeding programs in the Middle East and North Africa, on average, they have the least diverse food baskets given to children. Now, school feeding programs sometimes rely on in-kind food donations. And alternatively, they sometimes source food through domestic purchase. And with the global survey data, we're able to document how menus are more diverse when food is procured through domestic purchase. So we are much more likely to see items like vegetables, eggs, fish, and other meat on the school meal menu when a program sources its food through domestic purchase. The survey captures other information related to nutrition fortification. It captures information about nutrition and food safety policies. Another thing we learned is that countries with higher rates of obesity are more likely to view school feeding as a tool to mitigate obesity. And the last result I'll share with you is that the survey can be used to document how complementary services and also complementary education programs related to health and nutrition are very often packaged together in school feeding programs. So we learned quite a bit. I know I kind of zipped through those results. If any of it was intriguing to you, I hope that you'll go to the GCNF website and look at the full report. I do want to cover some of the data and measurement challenges we encountered in the course of this particular survey. The first challenge we noted is that in some cases, government focal points were not initially aware of the details of different programs operating in their country. And this was especially true in countries that had multiple programs operating, often with multiple implementers from outside. So they're not even aware of what's happening in their country around school feeding. And that just meant that it took them some effort to gather the information in order to submit a survey response for their country. Another challenge we encountered is that, somewhat to our surprise, in some cases, food would be served commonly in school settings, such as meals being served in government boarding schools, and yet this wasn't initially recognized as a school feeding program. So in some countries, they did not even realize that they belonged in the conversation about school feeding. This was a global survey administered every country in the world, or outreach was made to every country in the world, and it was translated into 7 languages. However, some terms did get lost in translation or were open to interpretation. And another challenge we encountered is that just half of the school meal programs in this survey were able to report some gender disaggregated numbers of students receiving food. And the likelihood of reporting gender disaggregated numbers was actually higher in lower income countries. This might reflect, for example, donor requirements around reporting. Another challenge that we encountered at GCNF was around how to construct some key indicators related to school feeding based on this survey data, such as the school feeding coverage rate, which is a very key measure that countries care about. A school feeding coverage rate is a proportion or a fraction. There's a numerator and a denominator. And we had to make a choice about what should be in the denominator. Just as some examples, this could be all children in the country, all children who are enrolled in school, thus ignoring those who have dropped out of school or who never attended school. It could be all primary school children, so narrowing our attention further, or it could be all children that meet certain criteria regarding need. And just to illustrate how impactful this decision is, we've calculated the school feeding coverage rate in sub-Saharan Africa using the data from the 2019 Global Survey of School Meal Programs using different denominators. So when we focus on the population of children who are of the age to attend school, school feeding coverage in sub-Saharan Africa is at 20%. And when we narrow our focus to only those of primary school age, the measured coverage rate increases to 25% because school feeding programs tend to be concentrated in primary schools. And when we narrow our focus to children who are enrolled in school, the measured rate is higher still, and then it's highest when we focused only on those who are primary school students, because now we are no longer paying attention to those who are out of school. In its report, based on the Global Survey of School Meal Programs, the Global Child Nutrition Foundation made a choice to adhere to the most conservative estimate of the school feeding coverage rate. In this case, it would be 20% for sub-Saharan Africa. And the World Food Program, in their recent publication, The State of School Feeding Worldwide 2020, they made a choice to adhere to the definition that is on the far right, which is also a completely valid way to construct this indicator. And the only reason I mention it is because I think it illustrates the way that we need some standardization of definitions around school feeding so that we're not using the same term to measure something that is different. Okay, to conclude, what data or research about data do we still need? First, we need more standardized data around school feeding to be collected universally and consistently. As we saw earlier, we do need better data on gender. We want to know whether repeating the global survey of school meal programs every 2 to 3 years can lead to improved data and reporting on the part of countries. I think there are a lot of people studying about school feeding and nutrition sensitive social protection who would love to understand clearly the strengths and drawbacks of relying on administrative reports for information versus self-reports that are often obtained through large-scale surveys. And there are also some specific data gaps that need to be filled. One example is in India, where the government has a really good view and a good sense of what's happening with the midday meal scheme, which operates in public schools, government-funded or government supported schools, but they don't know much about what is happening with school feeding in private schools. So that's an example of a data gap that needs to be filled. In terms of what research do we still need, I need to note that with great urgency, we do need to understand now the nutrition impacts of the COVID-19 related disruption of school meal programs. And then we thought of 3 specific research questions that sort of derive from the global survey of school meal programs. First, what is the potential of homegrown school feeding to support diverse food systems? Again, HGSF is a type of feeding program where the food is sourced locally from small-scale farmers. Another research question, is there a nutrition benefit? Does the nutrition benefit differ depending on how food is procured, whether it's procured by the program or whether cash is handed over to individual schools to then go to their very local markets and procure food for their students? And another research question at the very bottom, does local procurement come with a trade-off with regard to our ability to include fortified foods on the school meal menu? So these are just some specific research questions that we might explore. The report on the GCNF website includes a kind of a higher level discussion about research needs. The Global Child Nutrition Foundation would love to hear your feedback, questions, and even if you have any suggestions for what to ask on the next round of the global survey, we would love to hear from you. So I'll stop sharing now.
Great. Thank you so much, Ayala. I just want to encourage folks, we'd even love to get some of your feedback now. So please go ahead and put in that Q&A any questions you have for Ayala or any comments you'd like to have as part of our discussion. We are going to go right into Nadia's discussion, and then we'll stay on for a wider group discussion so that we can kind of maximize the time, especially for people who are maybe tuning in later in the day. So thanks. So we're going to actually now move over. So Ayala gave us a wonderful example of kind of this approach done through focal points to really get a sense of the state of nutrition feeding programs, and highlighted this issue, especially around data coming from administrative systems, I think is primarily what they used. And now Nadia is going to tell you a little bit about some efforts which are really focused a bit more on the survey side and how do we construct and think about measurements in a bit of a broader context. So hand over. Nadia, do you want to bring your slides up? And
yes, thanks, Rebecca. Thanks, Ayala. Great. So you can see my slides okay?
Yes, go ahead.
Perfect. Well, welcome everyone. As Rebecca has pointed out, today we'll talk a bit about coverage measurement framework and guidelines for assessing nutrition-sensitive social protection programs, specifically applying the lens through two school feeding initiatives. Just wanted to point out as well that this is a collaborative effort between Johns Hopkins University, IFPRI, and also GCNF. The aims of our work more broadly were multifold. The first was to develop a nutrition-sensitive social protection coverage measurement framework that identifies essential elements of NSSP programs, so I will use that acronym moving forward, including school feeding programs that should and are feasible to be measured, and then importantly, guidance on how to measure these in multi-topic household surveys or full program evaluations. Related to that, we would develop a core set of indicators and corresponding questions to be able to understand those phenomena. And then thirdly, to hold stakeholder consultations to get feedback on the proposed framework, indicators, and questions. And finally, once we have consensus on those questions and indicators, to carry out cognitive testing or field testing to try to understand how well those indicators work out in practice. I wanted to point out the types of NSSP programs that we're focusing on for this project. They are linked back to the Aspire classification of social safety net programs that you see on the left here, which includes a range of different programs. But we are focusing within DataDen on three broad types. So one is cash transfers, including both unconditional cash transfers and cash transfers and conditional cash transfers. Also food and in-kind transfers, and importantly, school feeding. Now, NSSP, as the name implies, is relevant for both nutrition communities and also social protection communities. And really, these two communities might have different goals looking at such programs. For our efforts within DataDen, we are really focused on developing indicators that are useful and can be taken up by the nutrition community. So we're focusing on the nutrition component related to nutrition-sensitive social protection programs that can actually be operationalized within surveys. So we are framing indicators around specific priority populations that are typically accessed and studied within the surveys that the nutrition community uses. and that can importantly facilitate co-coverage of nutrition interventions for these groups. So the groups that we're interested in include pregnant women, lactating women, children 6 to 23 months, the preschool age population, which is 3 to 5 years, and also school-age children and adolescents. I just wanted to point out for that last population there, though they're important for school feeding programs, typically the types of surveys that we're using within the nutrition community, such as the DHS or MIX, does not capture data for those populations just yet. So at present, Data is prioritizing looking at school feeding within the under 5 population, importantly, the 3 to 5 year population that is actually accessing school feeding programs, and where we can look at their coverage of not just school feeding, but also other nutritional interventions from within the surveys. Just to recap here, what is coverage? So coverage broadly is defined as the number who receive the intervention or program as a numerator divided by the number of individuals who are eligible for the intervention or the program. In the literature, there are several different ways of operationalizing that broad definition of coverage. You may be familiar with the coverage cascade that's been published that looks at defining coverage in a range of different ways. On the left-hand side, in the most simple form, just looking at target population, then contact. So any contact with the program, using that to define coverage, and then all the way to the right, looking at outcomes and adjusting coverage in relation to people achieving certain outcomes. And so in our work, we are focused on the middle here, looking at defining coverage as those individuals who are reached by the program and were actually eligible to receive the program. So I'm going to talk a little bit about our proposed coverage measurement framework, but before I get there in a minute, I wanted to summarize some of the work that went into designing this framework. So we, over the past year and a half within DataDent, have been working on multiple different research activities. So the first was to conduct a series of literature reviews of published peer-reviewed literature, gray literature, program documents, and other important documents as well, to try to understand how to define nutrition-sensitive social protection programs and what is the current state of evidence on coverage of such programs. Secondly, we went ahead and reviewed questionnaires and reports from national surveys and program evaluations conducted from within LMICs to identify examples of indicators and household survey questions. In total, we reviewed over 70 surveys and identified over 500 unique questions. We also reviewed global indicators for nutrition-sensitive social protection measurement from various organizations, including the World Bank and WHO, DFID, and so on, to try to get a sense of how are they defining nutrition-sensitive social protection and what types of data sources are they using, and how, importantly, how are they structuring their questions and what can we learn from that. Finally, we did a series of targeted country and program reviews of large-scale NSSP programs, and those were from the countries listed there. Really, we wanted to understand for these programs that have been in existence for a long time, how are they being measured, and are there coverage measurement frameworks used, and what kind of questions and indicators are being used, and we wanted to learn what was done sort of consistently and apply it to our own work. Some of the surveys that we examined are identified there on the right. So the MIX, LSMS, DHS, and others as well. I wanted to point out that we did model our work after the IFPRI IYCF counseling coverage project that was done. So this initiative proposed a coverage measurement framework that looks like, which is the one here on the left. It had 6 elements that that collectively were defining coverage of IYCF programs at the household level. And these included elements such as timing, target behavior, place of contact, and so on. So similar to this process, we've undertaken a really, I want to say a very similar process to do this. And we are proposing feasible indicators and questions that would somewhat align to a framework such as this. This is the framework that has been developed for this project from all the work that we've done and in line with that IYCF example that I showed you. So here we've identified 7 broad elements that can be used to measure NSSP programs. These include transfer type, size of the transfer, modality of the transfer, the target population, timing, frequency, or duration, so the time element, the provider type, and then importantly, conditionalities or co-interventions. Just wanted to point out that we think this framework can be operationalized in 2 ways. One is for including indicators within multi-topic surveys, and those core elements have been identified with the solid around the box. And then for deeper surveys that have more real estate to get into some of the nuances of the program itself, such as program evaluation surveys, additional elements could be included. And those are some of the ones that are that have the dash around the box. So I will describe these elements briefly here. The transfer type goes into exactly that. What is the type of transfer that was given as part of the program? So for instance, was it cash or food? Food ration, maybe school meals in the example of school feeding programs. What is the size of the transfer? So this is really the amount in units of the core benefit that was given from the program. And it could be currency, kg, kcal, depending on what the benefit was. The modality of the transfer, and this captures the location where the benefit was provided. So for instance, in the school, if it was a school meal, a clinic, or another location. And then also the modality by which the program benefits are actually delivered. So for instance, was the money given in debit cards, or did individuals have to go to cashiers to receive the benefit, or the food rations that children received, did they go to a distribution center to receive that food? The target population captures who receives and or qualifies in the household to receive the benefits from the program. So this would be, for instance, a pregnant woman, an under 2 child, perhaps a preschool age child, or a school age child or adolescent. The timing, frequency, and duration. So this captures the time period, the frequency and or duration that the target population received benefits from or interacted with the program. So I'll show you an example what that looks like in the next slide. The provider type captures the source from which program benefits are being provided. So whether they're coming from the government, NGO, or community, etc. And finally, conditionalities or co-interventions. This captures other interventions that are delivered as part of the program, and they may or may not actually be a conditionality or a requirement to receive the benefit. So for instance, cash transfers or take-home rations or other parts of multi-component programs. I wanted to bring this framework to life by walking through a Malawi school feeding example. So in Malawi, there are multiple school feeding programs. It's one of the countries we've come across that actually has 4 school feeding programs, several at least 1 or 2 at the national level and several at the subnational level. And here's an example of one of those programs, and I will walk you through what some of the responses to the various elements might be for one of those programs called the Mary's Meal School Feeding Program. So starting up at the top, this program for transfer type, they offer 2 different interventions or 2 different benefits. One is food or meal at school, and the second is a take-home ration component. The conditionalities that must be met: the child must attend school every day and must also take part in specialized education on growing gardens. For provider type, this program is provided by the government, WFP, and also supported by community members. For timing, frequency, and duration, for the school meal component, it's delivered for 9 months, 5 times a week during school. And for the take-home ration component, it's delivered for 9 months and 2 times a month. The target population is preschool age children or primary school age children who attend school. The modality of the transfer, for the location, the meal is delivered at school and the take-home ration is collected at a distribution center. And for the modality, the hot meal, there's a hot meal given during the lunch hour for the meal portion, and there's a voucher given for the food ration portion that should be retrieved at the distribution center. And the size of the transfer for the meal portion is just 1 standard meal daily. And then for the take-home ration portion, there's 1 kg of flour and 1 kg of fruit. So I will move on now to proposed indicators and questions that we're putting forth for large-scale multi-topic surveys. And I wanted to recap again here that this is how we're defining coverage. You would have heard from Ayala's presentation how this coverage definition has been operationalized using administrative data. And I will go into how we can bring this to life using data from multiple populations from within a multi-topic survey. So for this discussion and for the indicators that I'll talk about in the coming slides, I just wanted to point out that I will be focusing on global multi-topic surveys rather than more tailored program evaluation surveys. And importantly, just in the interest of time, I will focus on the former, but there is work going on in data for the latter as well. Some of the key assumptions one must think about when we're designing indicators for these multi-topic surveys are as follows. One, the indicator should be comparable across countries and also allow for co-coverage within individuals. So for instance, whether that child is receiving not just the meal at school, but also other nutritional benefits in the community or in the household as well. We also have to work around established norms from within the large scale surveys. So the DHS and MIX and other surveys, how are they currently collecting data? What are the recall periods they use? What types of data are they collecting? We have to work within these because it's really difficult to penetrate or bring about huge changes to such surveys. Also importantly, these surveys have limited real estate and enumerator capacity to include new or complex surveys. So we do need to be clever and parsimonious in the questions that we propose. And number 4, all surveys include a household listing with household member, sex, and age, which is great because that means it is possible for us to link mothers and children who fall within our priority subpopulations, and importantly, to look at co-interventions within the family where the mother receives a benefit and the child as well, and vice versa. Just to highlight some concrete examples from the assumptions that I've laid out and I laid out in the previous slide. So this is related to recall periods from within the DHS. Now, the DHS asks questions of various target populations, so pregnant women all the way to the preschool age child, and typically the window of which they use for recall, varies across these populations, but it is standard across DHS surveys. So when we propose our own questions, we have to work within this norm because it's difficult to modify this at this stage, of course, for comparability across countries and within the same country over time. So for the pregnancy related questions, typically the recall window is about 24 months or 2 years. And then importantly for the preschool age child, it's usually 3 months or 6 months. So when we're thinking about our own questions that we propose, looking at school feeding, for instance, we have to keep this type of recall window in mind. Here's an example from the MIX survey that illustrates a little bit about the way these questions are asked, or social protection questions from within the surveys. Again, for us to think about our questions that we proposed fitting within this existing structure and proposing minor edits or tweaks that'll make it more useful for the types of indicators that we're proposing for NSSP coverage. So the MIX has a whole module on social transfers, and it looks like this this box that you see here. So they ask questions in relation to a 3-month recall window. So the questions are, one is, are you aware of the program? The second question, has anyone in the household received assistance through that program? And so the program could be a school feeding program or it could be another NSSP program. And then another question, when was the last time anyone in your household accessed a benefit from that program? And you could identify who that was and when the last period was. Also, a similar example from the LSMS, but in the interest of time, I won't go into this. But you will notice looking at the questions from within the LSMS, they do ask a little bit more detail, and the recall window is different, 12 months here, and the questions at the household level. And importantly here, just wanted to point out that they do identify who the benefit was given to. And here in the MIX, actually, they don't identify the specific individual, though they do identify whether anybody received it or tried to identify that information. So given this and some of the challenges that I've highlighted, we've proposed two basic approaches to structuring indicators and questions and potential hybrid options. The first is illustrated here on the left. So if we can pre-identify a country program as NSSP, so for instance, Malawi's Mary's Meal school feeding program, and people in the country do recognize that program by name or perhaps by benefit, what one could do is we could ask about, number one, awareness of the program, as was done in the mixed example. And if individuals are aware, either by the program name or by the benefits received or the description within of that program, then we could ask if the target population, whether it's a pregnant woman or a child, so in the case of the Mary's Meals program, that would be a child 3 to 5 years, whether or not they participated in that program by name or description, and we would have the recall period as well, so whether that's 3 months or 6 months or 12 months. And if they meet these criteria, then we would say that individual is covered for NSSP. Alternatively, we could also ask about the transfers and any co-interventions separately. So for instance, was that child in the household receiving an adequately sized food or cash transfer, or for instance, the school meal component of the Mary's Meals program during the last 3 months or 6 months. In addition to that, did they receive the take-home ration? In addition to that, did they receive the conditional cash transfer, which is actually a feature of several school feeding programs that we've come across. And if the individual, for instance, says yes to 2 out of the 3 of these or 3 out of the 3 of these, we would say that they are covered for NSSP. Just wanted to point out that this is work in progress. This is our current thinking, but we are working on trying to test this approach and the feasibility of and accuracy of defining indicators in this way. Just wanted to summarize here quickly. So several school feeding programs are directly or indirectly covering the 24 to 59 month population. So that's the preschool age population. And we've identified in our work that many of these programs, many of the programs that exist in LMICs that are school feeding do capture more than 50% of preschool population, which is important and interesting. And so if one was to include questions for this population in large-scale household surveys, it would be valuable, and we could look at not only receipt of the NSSP program or school feeding program, but also co-coverage of other interventions as well within that population. For primary and secondary school children, existing data sets such as the DHS and MIX and LSMS don't actually collect data on these populations. So it is a challenge, to presently test the indicators that we're proposing. However, what we're putting forth could be used nonetheless in prospective data collection efforts, and in those surveys, for instance, school-based surveys or others that are looking at some of these populations, these questions could be integrated. Next steps from our work, we are planning to conduct a series of secondary data analyses with existing surveys where we will test our direct and indirect approaches to defining NSSP program coverage, the ones that I showed to you a couple slides ago. We will continue the school feeding review and test our measurement framework against existing programs and data sets for this unique type of NSSP program. We are planning to draft a conceptual piece on NSSP measurement generally, including school feeding, and to include parallel examples for program evaluations. We will test and validate proposed indicators before inclusion within the large-scale household surveys. And importantly, we are planning to prepare and plan for an external stakeholder consultation to have consensus building around the needs and options for NSSP measurement. That's all from my side. Thank you. And I will hand it back over to Rebecca.
Great. Thank you so much, Nadia. So 2 great presentations, and I've actually noticed there's a really rich discussion going on in the chat. So the way that we're going to do the Q&A period, again, we really encourage people, if you can, to actually put your comments or your questions, type them on that, hit the Q&A button and type them there rather than the chat. It just makes it easier for us to pull those out. That said, I have been, and Riley's been monitoring the chat, so I can go ahead and pull out a couple of the questions that are in the chat. Now we have plenty of time, so I encourage people. I do have some additional questions that I can pose as well, but really do encourage folks to please, as the discussion goes on, or anything you have right now that you'd like to ask either of our speakers, put it in the Q&A and under that Q&A box, and indicate if you do want it to go to one of the specific speakers. But so I will say, we have already had some good chat. I want to just say that Noreen, one of our participants, has been putting in some wonderful resources and experiences around doing evaluations of school feeding around different indicators. And maybe we could look at that a bit more together, but there's two specific questions to start out for you, Ayala. So the first was coming from Sarah Wheeler at Nutrition International, and saying, does the school feeding survey tool allow for a question on whether any micronutrients are provided, either as an addition to meals or as a supplement, even when food is not provided? And actually related in some ways is Harpreet Kaur's question about, is there any information or data on inclusion of fortified foods in the school meeting programs?
Yeah, thank you so much for those questions. The global survey of school meal programs does ask about the inclusion of fortified foods, also biofortified foods, and micronutrient supplements within school feeding programs. I can very quickly recap some of the results from the survey. 68% of school feeding programs around the world serve fortified foods, and the most common ones being oil, salt, grains, corn soy blend, or high energy biscuit. 22% of school feeding programs provide micronutrient supplements, and those could either be provided in the food or just directly to the students. And 12% of school feeding programs report that they include biofortified foods on the school meal menu. And the most common one probably is vitamin A rich sweet potatoes, or orange flesh sweet potatoes. And when it comes to fortified foods, the most common micronutrients added are vitamin A, iron, and iodine. That's all. Thanks.
Great. Thanks so much. So actually, we have another question that just came in. So also asking about whether they include insects as a food, and a unique food group.
On the global survey of school meal programs, we do have an other category when we ask about what is on the, what is included in the food basket. That other was ticked somewhat often, but never for insects. And so to my recollection, we never have an observation of including insects, but that's really an interesting question.
Yeah, especially if we think about the future of climate friendly food systems and things, we know that insects played a big part. So yeah, great point. Let me just double check if we might have another. So Sarah actually has a follow-up to that. So when you say schools, so when the schools say they do not provide any foods, do they ask if they offer supplements? So saying like a tablet, for example, I think is what Sarah's saying, like a vitamin type of tablet outside of actual food provision.
So the Arlene Mitchell, who's also here, might be able to jump in with a more eloquent response. But currently, the survey is structured such that it elicits a response for a school feeding program. So it would have to be in the context of a program that does provide some food to children through their schools. And within that context, we do capture micronutrient supplements that are provided directly to children, and it can be in tablet form. And we do ask about that in the survey. Now, if a country has a program of providing supplements, but entirely in the absence of food, that would not count. It wouldn't be defined as a large-scale school feeding program, and therefore it would not be captured within our survey. And maybe that is a kind of an important oversight. Arlene, you might have something to say about this.
Right. Thank you, Ayala. The issue has come up quite recently about whether we could measure nutrition interventions, not just micronutrient interventions, um, in schools if they're not providing food. And we have not thus far done that, but we are investigating in the future whether there would be value to looking at nutrition, school-based nutrition-related interventions if food is not provided. Particularly European countries have been encouraging us to think in that direction. So we are looking into it, but so far we do not measure anything other than programs that self-define as providing food in a large-scale school feeding program.
Thanks. And I should say, so it sounds like we actually have a similar thing. So Nikki Okeo says, she also would suggest deworming. And then Sarah would just clarifies that they're doing weekly IFA supplementation to adolescents in low and middle income countries. And so many of these schools do not provide foods. So it's just really coming from the context of their own program and probably reinforcing that if you are accessing school-based delivery of nutrition interventions, that I think a lot of people see it as an opportunity to potentially ask about things like deworming and other types of supplements. Just want to note, Edgar has a really interesting question that's a bit more programmatic. I don't think it's quite related to measurement, unless Edgar, you want to write a follow-up if this relates to measurement, but maybe I'd encourage Ayala, if you have a chance. He's a question about homegrown school meals programs. If you have room to type an answer, we could maybe give an answer and follow up, and we'll just keep our Q&A focused on the measurement aspects of things. So going to Nadia, I'm going to give you a couple of my questions, and then I'm going to come back with some similar potential questions. Would really like to know, so you talk about, compared to, so we know that in the global nutrition, they're actually asking a focal point, and it sounds like mostly data was coming from administrative programs, so maybe more from the school themselves about who they're reaching. But you're talking about doing a household survey where you're asking caregivers whether or not their children are participating in these kind of programs. And so as you're developing these, we know, testing out indicators, you mentioned that as being on your agenda. Would you give us maybe some idea about kind of what are some of the challenges you anticipate when you cognitively test these questions or try to validate them?
Yeah, absolutely. Thanks for the question, Rebecca. I think there are several challenges, related to asking these questions. I think given the child, the preschool age child who's 3 to 5, for that child in particular, the caregiver may be able to respond on their behalf because that child is typically in their care most often. When we start thinking about the older child, the primary school age child or the secondary school age child, I think there's always this question about whether the caregiver should respond on behalf of the child or whether the child themselves should respond. And so when it comes to school feeding programs, the primary school age child or secondary school age child is off at school, throughout their day, receiving a benefit, potentially bringing something home, and then coming back to the home space. And so when it comes to asking questions about these programs, for us, designing these surveys or the household, it's important to think about whether we should ask the caregiver or ask the child themselves. And I think there are important pros and cons to both. So for the child, they might not be as forthcoming about sharing information with their family members, for instance. So if they, as an example, something that's come up recently, if they were given a food ration, did they bring it home or did they not bring it home? And did they communicate that information about their ration to the family, for instance? And so that type of transparency and information might be a challenge when it comes to, asking the child themselves in front of the caregiver. And importantly, if we ask the caregiver about that benefit, is that caregiver even aware that the child received that benefit? So transparency of information is important. And when one needs to think about, if we ask the caregiver versus the child, what type of information might come back. I think there's other things to consider as well, whether, what is the right age for a child to start responding on their own behalf. You know, there's ethical issues around that, and also information sensitivity issues that we should be thinking about. So is a child who's 7 years old enough to be able to respond to our questions? Should we engage with them at the household level, or are they still, you know, within the care of their caregiver? Should the caregiver be present when we ask questions? Is it appropriate for us to talk to them alone? I think these are some of the kind of issues that could potentially emerge that one needs to think about.
Great. Yeah. And you really touched on, you know, taking this idea of surveys beyond what we're talking about, the DHS or things, and really started saying, especially as we go into schools, other kinds of surveys, what would be the challenges we encounter, which is really, really helpful. Encourage, you know, folks, if you still have additional questions, we've got some more time, so please feel free to put into the Q&A. But I'm going to then just give Ayala another couple questions that relate to some of their measurement approaches. So you talk about, so you did a survey where you really reached out to focal points in the countries, and you had the focal points report back. And actually, this is a way I noticed Maureen was talking about some of the UNICEF indicators on school feeding and SAM. And my understanding is they use a similar approach in their NutriDash for some of the indicators where we don't have coverage in household surveys. They also go to a focal point in country and have the focal point report on behalf of what is happening in country. So I think there's some parallels to your experience to others out there as well. But how could you trust? I mean, how did you determine whether or not those were valid responses submitted by the focal points? And then maybe related to that, you know, did you discover, you talked a little bit about the challenge, you know, that people didn't recognize, for example, boarding school meals as being school feeding. Were there any other parts that when you posed questions in the 2019 survey that they weren't understood or commonly skipped? So tell us a little bit more about that.
Sure, yeah. So when it comes to eliciting information from government focal points and deciding whether that information is credible and trustworthy, I can say a few things. First of all, before conducting the survey, GCNF, as I noted, conducted a background exercise, kind of a desk research exercise on school feeding in each country. And so before approaching the countries to fill out the survey, we sort of had in our back pocket a view of what we thought might be happening in the country. And so that was useful for comparing the responses we got to what some of our expectations might have been. Another thing I can say is that part of the survey process involved survey associates from GCNF interacting with the government focal points in a very interactive manner, a very conversational and collegial back and forth. And generating that kind of a good, positive relationship with the focal points, it ended up being critical to getting good information from them and to kind of encouraging them to go out and put in an effort to submit good, credible information. And in this relationship, GCNF is kind of viewed as a neutral party, and there's trust. And so kind of building that trust in data collection, I think, is really important because some of this data, it can be sensitive. And so kind of being viewed as neutral is very important. And the last thing I can say is that after this back and forth, after some verification, we did take the government responses as given. So there wasn't going to be any argument or something like that. Instead, once we made sure that they understood the questions, then we took their responses as given. I hope that answers your question. You asked whether there were some parts of the survey that are most likely to be misunderstood. And one response actually links back to the question that was asked before, related to biofortified foods. I think that in 2019, we noted that this term and this this concept of biofortified foods was often a source of confusion for the focal points. And that was a little bit surprising. And so it did inspire us to change how we worded the question and how we presented it in 2021. But it also highlights, or it kind of unearths some gap in what is known about biofortified foods as an option, including among people who are in charge of school feeding programs. So I think that we wouldn't know that unless we tried asking about it, but it's an important knowledge gap to highlight. Thank you.
Thanks so much. So we've gotten a couple other kind of comments/questions that I'm going to actually put to both of you, and feel free to respond. And I'm going to frame them. And of course, I would ask the people who pose the question that if I'm not framing them right, please put in a little note. So Noreen actually asked about what about a DHIS2 review? So the DHIS2 review being the administrative data, reported from the health facility. And I guess I'm trying to understand, Noreen, if that means like a DHIS2 review as being a way to get data on coverage for school feeding. And then I think that's a little bit related to what I assume the comment from Nikki Okoyo about what is the difference in methods of data collection. Yes, so school feeding indicators in the DHIS2. And then Nikki Okoyo said, what is the difference in methods of data collection done at schools versus in clinics? And I guess if we're talking about administrative data, you might have some experience of administrative data in clinics is something like the DHIS2. In the schools, I assume there's some kind of school record, but maybe also thinking about surveys in those groups. So I'm going to open that up again to see if either of you have any comments or responses to these comments from our participants.
I can, oh, sorry, please go ahead.
Go ahead, Ayala.
No, please.
I was just going to comment, I think zooming out a little bit, comparing, school versus clinic versus household. So with the household questions that we're proposing, I think the important, the piece of, asking questions at the household is being able to look at individual level receipt of programs, and specifically, co-intervention receipt. So whether a child in the household, understanding from that child or from their caregiver, if they're receiving the school meal and they're also receiving, a healthcare visit and also receiving something else. And so being able to pinpoint at the individual level for the child or the mother or the household as a whole, whether or not they're in receipt of these programs and the specific components in the programs, I think that is one thing in my mind that distinguishes defining NSSP program coverage at the household level versus the school or the clinic, which would be based on more aggregate information, potentially answered by a focal person at the school or at the clinic, who, and the numerator and denominator would come from administrative sources or from the clinic databases or school databases that, highlight the number of kids in the school and so on and so forth. So I think that's just one distinction that comes in my mind. And I think they're both important, but they do speak to slightly different things. And there's some different things we can be thinking about when we're thinking about co-interventions or, NSSP coverage at the household level versus the school or the clinic. So, anything here?
This isn't maybe a direct comment about the DHIS2 review, but I just wanted to note that when it comes to sourcing data from surveys versus administrative data from the programs themselves, it's good to kind of think about reasons why the numbers, if we're able to triangulate numbers, why they would not match in some cases. There could be leakage. So a program thinks that it is making food available, but it actually gets diverted before being received by students. And that would be really important to note from survey data. At the same time, there could be misunderstandings in survey data where the survey respondents don't accurately report having received food through their schools. And I think, Nadia, the work that you're doing is incredibly important to kind of lay out how these questions should be asked, and also to note how the way that they are framed in surveys can be quite confusing currently. And so just to comment that in terms of drawing information from sources like the DHIS2, I think there's a real need for research to triangulate and understand the validity of numbers that come from different sources.
Great, thanks both. Yeah, and I think Nikki's making some additional context about, I think this is the work, and you both talked about the need to clarify how we define indicators. And I do think there's some differences, right? If we're defining an indicator that we expect to be reported on through, for example, an administrative system, but also understanding how different administrative systems work. So for example, the DHIS2 in many countries, because it's a health management information system, there's some sort of register, some sort of individual paper book, in a clinic where things are recorded and then they're summed up at the end of the month and they're put up a system, right? And it could look very different when we talk about some of these administrative records in education, which might relate to individual students, but it might be some sort of documentation, like you're saying, Ayala, that food is being received at the school level. And then what happens with distribution is not necessarily being captured. So I do think this is why, these efforts to define indicators alongside of information systems and then thinking about how to kind of tweak them, because we know that it's really hard to radically change some of the established surveys. It's also very difficult to radically change some of the existing administrative information systems. And so I think both of these sets of work are a really great example of trying to kind of do that dance of having indicators that are feasible given the reality of systems that are already in place, but that are also giving us the information that we need. And I think it's really by going out and starting to collect these data, like you all have as part of your focal point-based survey, that we really begin to unpack and learn that. So I really think, both of these efforts are going to be incredibly valuable when we try to answer these questions of, who's being reached by school feeding programs, and with what kind of programs and at what quality level. But they're also, and what I often get excited about, they're also just illustrating some of the challenges we have with measurement in general. And as we think about other kinds of, nutrition sensitive programs coming out of other sectors, there's, I think, some valuable lessons to learn from this. So I don't see any more Q&A or any other comments. I will just give space if Ayala and Nadia, if you each just want to kind of give a little closing thought, and then we'll bring our webinar to a close. So Ayala, do you want to go ahead with a takeaway?
Oh, yeah. I think I saw a new question. I just entered.
Oh, well, how else can we get involved if interested? So maybe you can both reiterate your follow-up. How do people can get in contact with you, which I know will also be documented coming out.
Yeah. So how to get involved. The Global Child Nutrition Foundation is always happy to hear from people who want to be involved, particularly if you have suggestions for the survey, for how it is structured and administered, but also if you want to make use of it for your own purposes, please do be in touch, and we would love to have that conversation. In a closing comment, I'd like to note, just to recap, that the 2021 survey is underway right now. So we are busy at work trying to get good responses from all countries in the world. And we hope that the output from that survey will be available by next winter or spring. So early or to mid 2022. And please check out our website.
Great, thanks. And Nadia, any last word?
Yeah, thank you everyone for joining. Just wanted to say a couple of things. I think, so for this project, when we sought out to review the surveys and the literature, we really were focused broadly on nutrition sensitive social protection programs. And school feeding came up later on as something really important. And we are currently doing a deeper dive into school feeding. And so we may not have accessed all the surveys or program evaluation documents that are out there on school feeding, especially if they weren't in the public domain. So Noreen, to your point, I think if there are some good documents or other surveys that you're aware of on school feeding specifically, we would love to have access to those. And so it'd be great to stay in touch on that piece. And I think more generally, for anyone who wants to get involved or stay connected, feel free to reach out to myself or Rebecca or Riley, at any point. I think we will plan to have a expert review at some stage later this year in 2021. And if you'd like to take part in that, you're more than welcome. So feel free to reach out to us for that, or even just to have another chat on the methods, design, some of the questions and indicators. Happy to have any one-to-ones. Thank you.
Great, thanks. So as we go on to our closing slide, just want to thank everybody for participating. Nadia, do you want to advance to the last slide? Yeah, I just want to thank everybody for participating, especially for our speakers, Ayala and Nadia, and for Arlene being on hand as well, but especially for you all being a really dynamic audience. I'm excited to see some of the follow-up here, as well as where other people who will be watching this on YouTube will follow up. So again, this recording of this webinar is now available on the YouTube channel. And then we will be sharing the slides as well as a summary of the Q&A on the Data for Nutrition webinars group page in the coming week. And remember, we want to keep on talking about this issue of nutrition sensitive social protection measurement. So if you have a case or even just some work you've been doing or thinking on that you would like to share with our Data for Nutrition community, we really encourage you to reach out, because this is an open platform for the community. So thanks again for joining today's webinar, and hope you have a good rest of your day.